All right, so they're pulled out. Sometimes you will bruise in this area. A lot of stuff going on. But the risk of anything going wrong with threads are very low. There was a lot of controversy about threads, and I think a lot of it is, there was controversy about Botox and about filler and, everything else. These are, it's a sugar, and they use it in the sutures internally. So they decided to kind of take it to the next level and use it for cosmetic purposes. As you can see, this is a very small amount, a little swollen under here still, but this side is not done. This side is done. And we'll be doing another round. The reason I'm doing it right there is I'm eventually going to do what they call a cog. And that's primarily what you see when you search for threads and stuff. You're seeing actually what they call a cog. And that is, usually they do have blunt tips or sharp tips, cannulas or needles. Cannulas are blunt. And those are used with a pilot hole and then an insertion with little barbs. They attach to the skin and they pull it nice and taut. Now I want to create something for that barb to really latch onto. So I'm adding some PCL and PDO threads and screws. So what are those, right? I mean, you hear about it, you see these long needles, you freak out, you're like, what is that? I don't know. Anyway, so this is a twin thread I'm going to show you because it's easy to see the actual threads on there. I don't know if you can see it. I don't even know. There it is. So the thread is hanging off of it. And you can see the little white stopper is so the thread will come off inside the skin. And a screw is just this kind of thread spun around the needle. And they come in various sizes and different kinds. So there's pillow threads, PDO threads, PCL threads, and really all those different ones are between cost and how long that will last. And the longer it lasts, the more collagen and healing time. This is a screw, and they call it that because it's wrapped around there. This is great for lifting, and it kind of has like a spring, so it tightens really well. So threads can be uncomfortable, a little pinchy, depending on where you add them. I've done them in my lips before, did not love it. And in the nasolabial folds, I like that better than filler for multiple reasons. I don't really love filler in the nasolabial folds. You see women with too much filler here, and it starts to create an outward smile, and you look a little misshapen there. A little bit, fine, yes, okay, we all need a little bit. And I definitely need to do more work on myself since I don't get to that often. So I'm going to go ahead and do the other side. I really like to create kind of what I call a hammock underneath, and that will give more structure and support around the face. This is